We'll focus on a very specific product, meaning that we will only talk about a single product with a specific combination of this specific strain of bifidobacteria and lactic acid bacteria. Really, there were a very increasing interest in the potential role of probiotics in IBS through the increasing knowledge of the role of gut microbiota. Thus, most of the investigations were performed in IBS. And as it was already said, you have to keep in mind that not all the probiotic strains are the same. Therefore, you have to be very careful when you look at several meta-analyses that have been published that combine different types of strains for a general conclusion. And you have to really look at the meta-analysis looking at the specific strain combination. You have what we call the yogurt type product, meaning you have the combination of the symbiosis of yogurt with Lactobacillus bulgaricus and Streptococcus thermophilus and other strains that could be bifidobacteria or lactobacillus. And this is a complex interaction within this fermented milk matrix. On the other side, you have many dietary supplements that could contain different type of strains in freeze-dried form. Interestingly, you can consume some strains that are not able to grow on milk through this way of freeze-dried form. But really, this is two different ways. What is the composition of this specific product? So this product contains specific strains. And I also notice the other code of this strain, that is DN1730, that you could find in some papers. But this is exactly the same strain that have been quoted using different numbers. And you have the yogurt symbiosis, and also you have another strain that is a Lactococcus lactis strain. And this strain is more for a technological point of view. Another important point when you think about the test of probiotic food on GI symptoms is to which population you will assess the effect. So in that chart, you can see that, as Marilyn was mentioning, that the primary target for food is the general healthy population. Within this group of people, you have some people experiencing from time to time symptoms. And more than half of the general population is experiencing regularly some GI symptoms. And after that, if you think about IBS, you have different type of group of IBS, mild, moderate IBS, and the severe IBS. The boundary between the IBS and the non-IBS is moving along the time with the different criteria that have been defined. Sometimes it's quite difficult to really make the difference between an IBS and a non-IBS in this gray zone. So this is important when you think about your routine practice. Perform a systematic review and meta-analysis on this product that has been presented at the last Digestive Disease Week. And they really specifically look at the effect of the consumption of this product, specific combination of bacteria, on GI discomfort in the general adult population. So all the studies take the same dose of product during the same duration. That is really important. Thus, we can really compare the effect between the studies, and they use the same control product that was a non-fermented dairy product containing no bacteria. The outcomes were related to GI well-being and composite score of digestive symptoms, meaning combining bloating, flatulence score, rumbling, and flatulence, and abdominal pain. So in this area of research, you have to know that the only acceptable measurement is to use validated questionnaire, as we don't have biomarkers available to assess the impact of symptoms. Here are the results on the composite score of digestive symptoms. So as you can see there, all the effects for all the studies are going in the positive direction in favor of the product. And overall, there is a significant reduction of the composite score of digestive symptoms. And the effect is consistent across the studies, and they perform different sensitivity analysis by retrieving one study and looking at different confounding factors, and the result was the same. An important point is that we are in the general healthy population, and the effect was considered as small, modest. That is quite normal. We can't expect a high effect in a group of people having low symptoms. The other outcomes was the overall assessment of GI discomfort. So the subject is assessing overall what is the level or what is the degree of GI discomfort. And similar results were obtained with all the studies going in the same direction, sometimes being significant at the individual level and sometimes not. But overall, there is a significant higher odds ratio in favor of the product, so in favor of a decrease of GI discomfort. And once again, there is similar result obtained with different sensitivity analysis. In one of those studies, this is an interesting point. When you look at the effect of such product, that is here, so you have here the effect during the 4 weeks of double blind, and after you stop the product consumption and you look at the follow-up. You can see that here you have a significant decrease of the composite score of digestive symptoms. When you stop the product, the beneficial effect is lost within a few weeks. This may be linked to the disappearance of the bifidobacteria and of the strain from the GI tract, meaning that you need to regularly hit this product to get the benefit. Some investigations have been performed in IBS. So in this first study performed in 2007 in 274 IBS with predominant constipation during 4 weeks. It has been observed that there is a higher percentage of subjects reporting an improvement in their GI discomfort after 3 weeks. And as you can see, after 6 weeks of product consumption, we lose the significance. Similar results were obtained about the reduction of bloated feeling, with a significant improvement after 3 weeks and a loss after 6 weeks. And this can be explained by the high placebo effect that could be observed in such kind of a study that makes very difficult to detect the significant differences between the test product and the control. Another very interesting study that has been done by the team of Peter Wowell in the UK used this very nice device of abdominal belts. So this belt device allows measuring abdominal girth during the day, and as you can see, this population of women with IBS with predominant constipation, you have an increase in abdominal distension during the day until 5 to 6 centimeters from the morning until the end of the day. And after 4 weeks of product consumption, as you can see here, there are a decrease in this increase of abdominal distension with a maximum of 2 centimeters. In the control group, we have observed some effects. So, several studies have investigated the effect of this product on intestinal transit time. In a recent systematic review, 3 studies were found, the Bouvier, Marteau, and Agrawal. The 3 studies were randomized controlled double-blind trial. 2 studies were conducted in healthy people and 1 in IBS-C. You have to notice that the Bouvier study was performed using a fermented milk with only the bifidobacteria, not with the entire of strains. The authors conclude about a significant reduction of intestinal time, and this is one of the only strain with another strain of Bifidobacterium lactis that has this ability to accelerate colonic transit time. What is interesting here is that, as you can see, this functional benefit has been observed in both healthy population and IBS-C. In the study of Agrawal, the author also looked at the effect on the small bowel transit time. And interestingly, they found an acceleration of the small bowel transit time, meaning that this product is also able to modulate the upper GI tract. A last point about motility. In the study of 2007, the impact on stool frequency was assessed. When we pick up the group of subjects with low stool frequency at baseline, less than 4 stools per week, we observe a significant and consistent increase in stool frequency all along the 6-week period of product consumption. A very interesting study made by the team of Emran Meyer in the UCL was about the investigation of the impact of this food on the brain activities. So this study was performed on a group of healthy women without any GI symptom of psychiatric disorder. The subject consumed 4 weeks of product, during 4 weeks the product, and before and after this product consumption period, they have a functional magnetic resonance imaging test. This was the first time that in humans we have the demonstration that such probiotic food can modulate brain activities. So as a summary of this is evidences, when you heat the product, the bifidobacteria is traveling all along the GI tract and remain alive. This may modulate the gut microbiota and possibly some metabolism of the gut microbiota like gas. That may explain the reduction of some gas-related symptoms like flatulence. And we have also shown through preclinical study that we have a modification of the permeability of the gut that may be involved in the modulation of the gut sensation, the perception of the gut sensation, explaining the reduction of the bloated feeling or rumbling. But we have also shown that we have some modification, acceleration of the colonic motility that could be linked to and may explain the reduction of abdominal distension in ABS-C, and all those effects contribute to this overall sensation of decrease of GI discomfort. Muchas gracias.